Welcome to episode 5 of The Dreamers. Today here with Dr. McCullers, and we're trying to bring you guys great guests, provide better insight. I'm Munir Rahman.
And I'm Asfan Musa, and Dr. Jonathan McCullers is the Dean of Tilman J. Fertitta UH College of Medicine. He is a physician scientist who has an expertise in medicine and education. Dr. McCullers, we're honored to have you on our podcast today. Thank you so much for being here.
Hey, happy to be here, guys.
Well, thank you for coming on. I feel like it's a big deal for a lot of people, especially in Houston. I feel like we haven't seen interviews with deans a lot. I also want to give a quick introduction. From publishing over 180 scientific papers to serving as a hospital leader during the COVID-19 pandemic, to now sharing the future of medical education in Houston, Dr. McCullers brings a powerful blend of compassion, leadership, and purpose to everything he does. So for the first segment, I kind of want to talk about your journey a little bit. I want to talk about your journey in medicine specifically right now. Is what inspired you to pursue a career in medicine, especially pediatrics specifically?
Yeah, so as a kid, people go out and they see their family physician and they're like, oh, I want to be like my family physician. And, they see that compassion there and they're like, I want to do that for people. I was the opposite. My mom always told me, you're going to be a pediatrician and you're going to cure cancer. And I was like, I'm not going to be a pediatrician then. I'm not going to go into cancer or anything like that. And but I went to college, went to the University of Virginia, and was doing interdisciplinary studies with some pre-med and some engineering focus because my dad's an engineer, and he wanted me to kind of go into biomedical engineering. And then my fourth year, I did this class on virology, and it was this emeritus professor who was just like a crazy old guy, and I just loved him so much because he would start talking, and we're supposed to talk about tobacco mosaic virus assembly or something. And then he would go off on this wild tangent about, the HIV had just broken out. He's like, we need to test vaccines on prisoners and stuff, and then debate the ethics of that with us. Yeah. And I was like, this is so cool. I want to do medicine now. And, I want to study virology like he did, but do it through a medical doctor path.
Great. Okay. And that was your third year of college?
It's my fourth year.
Fourth year. Okay.
So I was kind of making the decision that I'd done a little research in a couple of laboratories, and I did some research in between my fourth year and then when I started medical school. But he's the one that kind of got me to be a virologist and to kind of really want to pick medicine as the path.
Okay. So it's fourth year you decided officially. That's crazy, yeah. Most people think you need first year, you need to know. But I think it's a good story to show even if you're deciding in their fourth year of college or senior year, it's possible.
Yeah, now I'd taken the MCATs already. I kind of was prepping for either way I wanted to go, but that was kind of what pushed me over.
That's good.
And are you still in touch with, or probably not, but were you in touch with the professor for a long time after you did become a doctor?
I'm not, but he was in his 80s, and that was that was 30 years ago. So.
All right, I just want to talk about you grew up in Virginia, and were you the first in your family to graduate college?
No, my dad and his brothers graduated college, and then I was the first doctor.
Okay, first doctor. Okay, yeah. And then how did that background kind of shape your perspective into healthcare access and equity?
Yeah, the equity thing is interesting. So, I grew up in a little bit different time than you're growing up in, and my parents grew up in a different time than I grew up in, and they grew up in rural North Carolina in kind of a mainly rural white population. And so there's a lot of sort of, at that point, still racial disharmony. I was one of the last generation that went through busing. So if y'all know what busing is for integration of the of schools, we always think about it as kind of the white flight because they were busing other races into the city to integrate the schools, but it cut both ways. Yeah. And so I was bused to a black school in the inner city. And so had an integrated education at that level, went to University of Virginia, which has great programs, and then moved to Memphis and worked in Memphis the last 28 years, which is majority African-American city. Yeah. And so I've always been in the environment of, diversity and trying to work with others who may have a different background than you. And so my viewpoint's just always been different than what you would stereotypically think about a white male, who's a dean now, right?
Yeah.
So this is the perfect opportunity for you to be the dean of UH College of Medicine because, as you know, Houston is very diverse.
Yeah, Houston and the state of Texas generally very diverse, and you see it. You walk onto the UH campus for the first time, and you look around, and you're seeing every culture, every creed, religion, whatever. They're all represented. You can just see it in the students, and it's a cool thing, and that was an immediate attraction to me. When I visited, was interviewing and stuff.
100%. I feel like it's also very supported too at U of H, across all campuses. It's very supported to show support for all those different cultures and stuff. So I definitely think that. So you kind of already talked about this, but like, what was your like? When did you realize your path was into like academic, like because you talked about your research already? What kind of led you to that? But what was like your thing towards academic or education?
Yeah, so I mean, I really came into this wanting to be a researcher, wanted to be a virologist. I wasn't sure what virus I wanted to work on. I worked on HPV, human papillomavirus, then I worked on HSV, herpes simplex virus, and I ended up my career working on influenza. An interesting path to get there, but that's what I wanted to do. And then it was like, well, what specialty am I going to do that? Well, if I'm going to be a researcher predominantly, and so I always said, well, I'm going to do anything except pediatrics, right? Because I was kind of scared of kids, I gotta say, right? And so, I interview students who want to go to pediatrics all the time. They're like, oh, I was a nanny growing up, or I did all these camps. I was around kids all the time, and I did none of that. And so I was like, But you go into a children's hospital for the first time, and it's just a different environment, right? And I was like, oh man, I fit here. And then it turned out I was really good with kids, and so that's why I picked pediatric infectious diseases, and then virology research as a subset of that. So the academic piece was driven by me wanting to be a researcher and wanting to be in that teaching hospital environment. And so, my first job was at St. Jude Children's Research Hospital, which is it's a major biomedical institution that's kind of wrapped around this little boutique children's cancer hospital. And so I could do clinical care and infectious diseases with these kids who had cancer, but also HIV. It's a big HIV center, sickle cell disease, and then I could do my research there as part of my overall job.
Okay, perfect.
And I do agree. Like, in my opinion, if you want to excel in like pediatrics, you have to be good with kids. Otherwise, it just makes
one of the main things I guess you kind of need.
My trick was, one of our grandfathers was like this funny guy, and he had all these little tricks he would do on us and all these little mannerisms. And so when I started working with kids for the first time as a student, I just like imitated my granddad and did all his little things, and it worked on the kids just like it worked on me. Right?
That's funny. No, that's amazing.
That's great to hear. All right, let's move to the next segment.
Okay, I want to bring up the time during Memphis when you led Le Bonheur Children's Hospital, and you also chaired Shelby County's COVID-19 task force. What was it like being at the center of such a high-stakes public health response during one of the most difficult times in the modern medicine?
Yeah, so I'm a pandemic researcher. So my research was around influenza viruses and why you get bacterial pneumonia when you have the flu, and how a pandemic virus differs from a seasonal virus, and why we need to worry about pandemic viruses, right? And so when COVID started traveling around the United States, I mean, I knew exactly what was going to happen the next 2 years because I had studied this my whole career, and you could see what was going to happen, right?
Yeah.
And so our city and county, started to talk about what do we do, how are we going to handle this? And I sat down with my boss, which was the dean of the college, and said, hey, we need to lead on this. We are the experts.
Yeah.
We need, and so I sat down one weekend and I wrote a roadmap. I called it the Memphis roadmap for COVID-19, and it went through in detail every single step we had to take. Then I held a press conference and invited all the media there and said, UT, University of Tennessee, is going to lead this region through COVID. And so we adopted the roadmap, and it called for creating this task force and bringing it together, not just, like our city officials or our county officials, but all of our city and county together, bringing in the other 16 counties around Memphis, including some in Arkansas, some in Mississippi, and saying we have to have a unified approach to COVID. We can't have you cross the border and things totally change, right?
Agreed, yeah.
And so then bringing in, we were the university presidents, but then bringing in the CEOs of all the major hospitals so that the health systems are integrated with what we're doing, and we're all, doing this with one voice.
Yeah.
And then later bringing the schools in. So once we started to think about back to school, we started bringing all the superintendents of the school systems. And so we tried to have an integrated approach where we all used, evidence-based science to drive what we're doing, and we all held together, and no one mayor decided, I'm going to be rogue and go off and do something totally different. And we were able to keep that together throughout the pandemic.
Yeah. That's amazing. Yeah.
I think I like the fact it was like a joint operation. It wasn't just your school doing it or a hospital doing it. I feel like the whole city or the state kind of worked together, which was really good.
It shows you how much effort goes behind something like this, like leading.
Behind the scenes, yeah.
Yeah. So.
And there were a lot of political divides in Tennessee and other places around the country. But we were able to avoid a lot of those problems that cropped up in other places because we had gotten everybody together and we're like, hey, we're going by the science. We're following, Dr. McCullers because he's our expert.
Yeah.
And then, I'm on the TV every day. I'm doing radio shows. I'm doing podcasts. I'm penning op-eds. I'm getting interviewed by reporters every day. And so the public saw me out there and knew I was being straight with them on everything. And so they trusted us and they trusted the task force because they knew that I was, in the middle of it.
Yeah.
Thank you for the work that you did. Yeah, it was amazing. And moving on from that, a lot of people don't know this, but during the same time while you were leading Memphis through the pandemic, you were having a private battle of your own. You were battling prostate cancer. So tell me about that. How did you carry that emotional and physical weight while continuing to lead so publicly at that time?
Yeah, so that was an interesting time, right? So the pandemic starts in March in our area, and then by May we have this task force up and running. I'm working 100 hours a week on all this, doing my regular job, doing a second job that I won't go into that came up that I had to take on, and then doing all this COVID stuff, which was all encompassing because of how much was going on. And then in September of 2020, we're right in the middle of the big wave. I get diagnosed with prostate cancer, right? And it runs in my family. My dad died of prostate cancer. My grandfather had prostate cancer when he died. And so I knew I was at risk. And so I'm making sure I get screened regularly and checked, and I'm paying attention to it because I know I have this risk factor, right? Pops up positive. I'm like, okay, well, we got to deal with this. And now I have to start on chemotherapy. So I take a year of chemotherapy. I have to have surgery in January to have my prostate removed and have to get rid of the tumor. And all the time I'm leading the city and the region, and I feel this intense pressure to not drop that, right?
Yeah.
And so I don't tell anybody except my boss that I'm going through this. I just keep it a total secret, and I start the chemotherapy. And the chemotherapy they give you is this hormonal therapy, and it crashes your testosterone down to zero because the prostate cancer kind of feeds on the testosterone, we'll just say. And so the result is you go into sort of like a menopause. So like I understand my wife a lot better now and her struggles because, I'm having night sweats. I'm having these shaking chills all the time. I'd go into meetings at 8 a.m. and sweat would be pouring down my face because I'm having a hot flash. I'm gaining weight. It's all these horrible side effects, but the side effects are from the chemo, not from the prostate cancer, which we got rid of. And then I have to have surgery. I had surgery in the morning, and I'm on Zoom calls running things in the afternoon.
Oh, wow.
It's just, and so I didn't talk about it with anybody until, a couple years out when I'm leaving Memphis. One of the reporters wanted to talk about my experience, and so this, I shared that was a big part of the experience for me is, not wanting people to know because they want to trust me as the leader of this effort. And what are they going to think if they know I'm battling this thing, right?
Yeah.
They're going to be like, John, slow down, and we'll let somebody else do it. I'm like, nah, we need to serve the people here.
Yeah, but you were successful in both, beating the cancer as well as like helping lead the operation.
Yeah, completely cancer free, and I lost all the weight that chemotherapy gave me.
Congratulations. Yeah. And what gave you the strength to keep going during this time, and how does that experience shape how you lead today, especially with mentoring the next generation of physicians at College of Medicine?
Yeah, so one of the things you learn in medical school is how to work hard. It is not easy to go through medical school and to succeed. It's a lot of hours, it's a lot of studying, it's a lot of work. And you kind of learn that work. If you didn't have it before, and a lot of our students do, right? But if you didn't, you learn that. And I learned how to work 40 straight hours without sleep. We don't do that anymore to the students, but we did certainly back when I trained, and how to be on all the time and be doing the right thing all the time. And so I flipped back into that mode because I was having to do all this work, but you do it because you have to. Somebody has to do it, and I'm the best person for the job, and so I'm going to do it. But I had been trained through that. In terms of the leadership, I had been growing as a leader for some years. This was, 7 or 8 years into me running a large department at a College of Medicine, and helping to run a major children's hospital that's growing. And so I had been leading, I'd been reading leadership books and, reading a lot of stuff about how do you do this, and then working with an executive coach about leadership. And so it kind of, I was prepared for it. It was just something that I knew I could do. I knew I was the right person and I had the right, way to go about it. And fortunately for everybody, it worked. And I think we did as well as anybody in the country.
That's good. That's good.
And for anybody trying to take on a leadership role, what's your number one leadership book that you would recommend?
Oh, it changes over time depending on what you're trying to do. I think the best one I've read is something called Rising to Power, and it's about becoming a top executive. So it's not about necessarily just regular leadership, but as I'm moving into a role like being dean and vice president, major roles at a university, that book takes you through how you release the little day-to-day technical stuff that you like to do because you're good at it, the detail work. Yeah. You have to let that go, and you have to let somebody else who's good at it do it while you're way up here at the next level doing the vision and doing the big picture stuff. And that's really hard to do. And that book, kind of helped me with that process.
And do you believe you should have like a trustworthy team with you? If you're leading at such high stakes, you need to have a team that are full of trust.
Yeah, you got to build your team. Now, I came into a situation here where there's already a great team in place. The founding Dean Steve Spann, did a great job. Mm-hmm. Yeah. We've had to reshape that just a little bit over the first year, but by and large, the team's intact. What I am doing is working on putting sort of my culture into it. And so we have a weekly meeting where we get together and discuss everything that's going on in the college. I have them reading some leadership books. So we read a chapter every week and we talk about it. What does it mean for the college? What lesson can we learn from this? And it's sort of a team bonding thing that we can do and talk through some of the things that we got to work to get better at. Yeah. Talk through them through the lens of something that we're reading jointly together.
Amazing.
And I feel like our few guests, Denise, she was from MD Anderson. She was talking about her team and how like they all trust each other. And that's important, especially in a work like life balance kind of thing, where you're trying to like have a good team that supports you, like a support system kind of thing, right? So I think that's really good that you have a great team here.
Yeah, and that trust grows with time, right? Yeah. So I have to earn it, right? I don't just come in here and because I'm the dean, people trust me, right? So I've been here 10 months in these roles, and so I'll do one of those 360 evaluations of my performance and let them all give me feedback when it's been 12 months. Mm-hmm. So I was actually setting that up today. And I'll continue to try to make myself get better, and I'll continue to try to earn that trust by, doing the right thing and showing, and leading in the right way.
Amazing. Let's move on to the next segment now.
All right. So now you're the dean of Tilman J. Fertitta Family College of Medicine. Now, you kind of talked about what drew you to Houston, but specifically this med school, and what was the mission that you saw in this med school that you really liked?
Yeah, so when I was ready to take that next step and become the number one, the dean of a college of medicine, I actually interviewed at a number of different very prestigious, colleges of medicine around the country. And it was very clear in some of them that were well established that I could come in, I'd be the dean 5 or 10 years, I'd leave, next person would come in, and nothing would be different, right? Because they've just been the same for 100 years, right? Yeah. And so there were really two things that attracted me here to this particular College of Medicine. And the first was, it's new, right? We just graduated our first class.
Yeah.
There's lots of challenges, and I like to solve problems. I like to meet challenges. So there's a lot of kind of stuff I can do that isn't just routine administrative tasks like I'd be doing as dean of some other, more prestigious maybe at the, you would think, College of Medicine. And you can grow and we can build, and we are, trying to grow. Right now, we take 60 students a year. We're trying to get to 120 students a year, which means you need more faculty, more teachers, more clinicians, more researchers. We're about to launch a research strategic plan for how do we grow research in the college and work with the university to grow research across the whole university in health-related fields. You have to work with all the health systems and hospitals and clinics and find places for our students to train. And so there's a lot to do and a lot of challenge, but you can really put your mark on this and put your stamp on it because I'll be the one who built it. Now, Dean Spann founded the place. He did an amazing job. I wouldn't have wanted that job. That's much harder. I get to kind of do the fun part is what I say, which is the growth part. And the second piece is this medical school is a little different. It's very deliberately a community-facing medical school, right? So what do I mean by that? Well, a traditional medical school like one I went to, you do 2 years of the book, hitting the books, learning the basic sciences, and then your third year you go into the clinics and into the hospitals, and you sort of, through an apprenticeship model, start to learn what it's like to be a doctor clinically. Here, we have the students out in the community doing home visits in their first month. And that's longitudinal throughout their experience, that they're getting those clinical experiences from the very beginning. And they're getting them in a community setting where they can see what we call the social determinants of health, or the non-medical drivers of health, those barriers to healthcare delivery that usually follow poverty, but also follow a lot of other issues and problems many of our patients may have. But they're learning about that from the start, not as something abstract that they won't see until they're in the community in year 3, but from the very beginning. So it's an integral building block. And then we're trying to teach them about value-based care. So how do you deliver the highest quality care at the lowest cost? So that's a new-ish concept that many practices in Houston are developing and are employing. And that's going to be more and more of the future of medicine. So we're trying to teach them for what's coming, not what's necessarily is here right now. And then they're very much as a servant, leader mentality, both at the top with me, but then we're trying to put that into our students as well. So they want to serve the underserved and to give back to the communities. And we're a school that openly says we want to train primary care physicians, and we want them to go back to those communities that we're recruiting them from.
That's amazing. Great answer.
Yeah, honestly, I also feel like, U of H, I feel like tries to help the underserving community a lot, especially in Houston. So I feel like that balances with your kind of work too. It's like in Tennessee that you did. So I think that's really good.
Yeah, so again, I spent 28 years in Memphis. Memphis sits in the middle of the poorest large MSA, metropolitan statistical area in the whole country. And so poverty drives everything. And so my time in Memphis, I was very active in the social services sectors and sitting on boards and working, with the underserved. And so it's kind of a natural fit for me here, because you see some of the same problems as Memphis. And now you have medical school. It's being deliberately designed to address those things.
Oh, that's great. And also, because you're coming from a research-heavy background, how do you balance the emphasis on community culture and the political bias that kind of comes through? Is there a certain way you balance that?
So I'll tell you, my recruitment here, the one thing the faculty were a little nervous about, they're like, that Dr. McCullers, he's going to come in here and try to make us into a research powerhouse and ignore the community, right? So that was like their concern that they talked about. They even told me a little bit that they were concerned about that. So that's something that I've had to convince them, and through my actions, not my words, that we are going to maintain the same values. We're going to still stick with the mission. We are going to grow research, but it's going to be research into how do we make things better for the patient population, our community we serve, right? We can have a big role there, and that can be kind of how we stand out from some of the other outstanding medical schools that are here in Houston or across the state, is that community focus. And if we can become a research powerhouse with that as our focus, all the better for us, right?
Oh, I think that's great to hear. Right. Great answer.
All right, so I want to talk a little bit about your family and how you balance your work life. So you and your wife are both physicians. She's also a pediatrician, if I'm not wrong.
She is a PhD in public health and has a master's in epidemiology. So she's actually what we call a dissemination implementation scientist.
Okay.
Nice.
So she's on the faculty, here at UH. And she studies things like barriers to care, structural, social barriers to care. I'll give you an example. There's something called peripheral arterial disease. You have diabetes, and you lose circulation to your lower limbs, and it results in amputations in extreme cases. If you look at poor populations versus more affluent populations, the poor populations, the amputation rates double. And that's because of access to care and other structural barriers to care. So she works on how do we eliminate those barriers to care so we can even out statistics like that. And so, it works in a lot of chronic health. So again, a good fit for what we're trying to do here at the Fertitta College of Medicine, right?
Yeah. And you both have clearly very demanding careers, I bet. And how were you able to manage your work-life balance while raising a beautiful family? Could you talk us more about it, and what advice would you give to someone who's trying to do the same thing? Somebody who wants to do it all.
Yeah, so it's a tough one. It's a tough question, right? And so we're a blended family. So we have 7 kids between the two of us. 5 of them are through college and are out there in the workforce, and so have jobs and are all good. And then one's going to college this year, and then I've got one finishing up the 12th grade. The last 2 stayed behind in Memphis. We didn't want to take them out of their high school when they're just about to finish. It stayed behind with their mom, my ex-wife, right? So so the challenge now really is for us when you talk family is we have a new puppy. So we have this rescue puppy that we got when unfortunately my longtime dog died this past Christmas.
Sorry about
and so we got this puppy, and we're told it was a Jack Russell Terrier, so it was going to be like this little thing.
Yeah.
And it turns out it's like some other type of terrier, and
So
she's like 7 months old and 45 pounds.
Oh wow!
Oh my God!
And so dealing with her, it's like having a baby in the house.
It was not expected at all.
No, and obviously, trying to get her house broken and have her not chew up everything in the house while we're away. She actually got my sunglasses earlier this week and chewed up my Oakley sunglasses.
Oh wow!
I gotta get those fixed at the College of Optometry this week, right?
Yeah.
So, but yeah, it's one of those things where you have to communicate. You have to say, what's important to me. I'll tell you, as my career has gone on, I've tried to be more family focused. When I was a big-time internationally known researcher, I was working all the time in the laboratory. And, that's not too conducive to a great family life. And so learning that balance and learning how to say, well, how do I prioritize my wife and making sure I have time, to go to dinner at night, or how do I make sure I'm not working on the weekends all the time? I've tried to purposely cut down on the amount of work I do on the weekends to kind of facilitate that balance. But it has to be a very sort of deliberate thing, because these careers that you can get into as a physician, they can be kind of, subsume your identity and become everything you do if you're not conscious of it. I will say the younger generation gets it a lot better than my generation did. And so we're seeing a bit of a cultural shift when you're bringing in our newer physicians, and that's a good thing. It creates some challenges for the medical workforce perspective, but I think it's a good thing in terms of the health of our physicians.
Amazing advice. And moving from that, you talked about NIH research, and then you ended up doing academic leadership, and now you're helping build a really recent medical school into one that could compete and that could compete with the rest of the medical schools nearby and help grow future primary care physicians in the Houston area. So you've clearly had like a very successful career. Congrats on that. What achievement are you most proud of?
So when you say what, kind of what thing are you most proud of, it really is the number of people who have come through that I've recruited and that have kind of grown up in the environment where I'm the leader, right? So, for instance, when I was the chair of pediatrics at Le Bonheur Children's Hospital, we would recruit, somebody onto the faculty who's fresh out of their pediatric residency or fresh out of their pediatric nephrology fellowship, right? Yeah. And then seeing them with mentorship and guidance and in the culture we had created there, 5 or 6 years later, now they're a nationally prominent physician and they're being invited to be on these councils that are making decisions about medical guidelines for, whatever disease, and seeing them get a claim for that after knowing them when they were just, a student or a resident. That to me is the most fun thing about this job. And so, here at the Fertitta College of Medicine, it's going to be seeing our students take that journey, graduation, they go to residency, where are they going to end up in their careers, and what's that going to look like? So that's very exciting. If we talk about just a single accomplishment, it really was building Le Bonheur into what it is. So when I got there, it was a nice regional community-based children's hospital, but we had a very aggressive CEO. She wanted to grow the academic side. She recruited me. We grew, new educational programs, research programs, clinical programs, doubled the faculty my first 5 years. And within 7 years, we were a top 30 comprehensive children's hospital nationally. Oh, wow. And so I'm proud of taking this from point A to point B, and then hopefully that's what we're going to do at the Fertitta College of Medicine, is take it from point A to point B, and that point B is going to be a lot bigger than it was when I got here.
Beautiful.
No, great answer.
And how do you hope your students, your faculty, and the broader community remembers your leadership 10, 20 years from now?
So when I think about that, it's really about where they got to. So I want them to think that I helped them on that journey, and that part of the reason that they've been successful, and I want them to be successful, is because of the culture I created. And when I talk to my leaders, right? So I have a team of leaders under me at different levels, and they all say, John's the best leader I've ever had, because I really do care about their success. It's not me succeeding, and it's not even to some extent the organization. It's if they're my direct report, I'm responsible for making sure they succeed, and they get that, and they feel that, that care for them. And then they're successful because I pick good people and I put them in a position to succeed. But that's kind of how I would answer that.
Amazing. All right, move on to the next segment.
Okay, so we had some of our followers ask some questions, and also our old student org, American Medical Student Association from U of H, that has some questions too that we want to ask y'all.
Great.
So how does U of H College of Medicine curriculum reflect your overall mission statement, and how do you think students can reflect that in their applications?
Yeah, so I think the things we're looking for in the applications are, you want to give back to your community, particularly if it's primary care. And not everybody who comes through decides on primary care. They're all interested in primary care, and about 2/3 of them are going into primary care. But you come in and you get exposed to dermatology or something. You're like, oh wow, I want to do that, right? But interest in primary care, interest in giving back to the community, and then some evidence of that. Have you done some community service? Have you shown that you have that passion for it? So I think those are important. Obviously, your GPA and your MCAT score, to get in the door. But those are the qualities that we're really looking for. How does it fit the mission? The curriculum, as I talked about a little bit more, it's very community focused curriculum and value based care focused curriculum, which I think meshes with what you see. The mission statement's really true, and a lot of times you'll have one mission and vision out there, and maybe you're doing something a little different. But for us, that it pretty much hits the nail, I think.
Nice. And how do you ensure that students from all backgrounds, we briefly discussed this, it is a very diverse school. How do you ensure the students from diverse backgrounds feel confident, supported at UH College of Medicine? Yeah,
so that's always a challenge when you're operating in such a diverse city as Houston, diverse ecosystem as University of Houston. And the way I think about that is, we have a team here, and the team is our faculty, it's our staff and support, personnel, our community health workers. It's our other health colleges that we interact with, like nursing and social work, for instance. And I want my team to be diverse as well, because there's strength in diversity of viewpoint, of background, and not so much just pinning that on race or ethnicity, but we're 21% of our students are from rural backgrounds in Texas, and so we need to have that represented on our faculty. We need to be training the students in a way that they understand the barriers to care if you're in a rural setting, right? So that's part of it. People would think about it in terms of more traditional urban poverty, but it's really kind of all these different challenges that you see. And how do you build a curriculum? How do you build a faculty that represent that and can train students around it?
Great.
Okay. And the last question is, when reviewing applicants with similar academic metrics, what personal qualities or experiences make the applicant stand out to your admissions committee?
Yeah, it's a hard one. Again, it's having that authentic desire to serve the community is important. And sometimes you can get that and sometimes you can't, right? It's hard to figure out, which is why it makes it difficult. So I think, the ability to be authentic in that, and then maybe to have some evidence that you've actually done some of that, is very helpful to us. And then, you're interviewing a number of different faculty here, and some of it, I gotta say, becomes subjective. How well did you get along in the interview? How well did you do in the interview? That's the tough part to explain, because so last year we had a class of 60. We had 5,400 applications.
Oh, wow.
So how do you sort through that when you got 3,000 who are in the range, that
sounds very tough.
You would think about, right? It's hard for the admissions committee. And so they got to make some decisions. And when they make decisions, they're inevitably going to be students who are perfectly well qualified, who would do fantastic here, and just don't make it because it's a numbers game. Yeah. And, we started a new medical school in part for that reason, right? Where there's a physician shortage, but there's a lot of demand. So can we meet some of that demand and make that a little bit easier?
Nice. And before we move on to our last segment, there is another question that I do remember. One of our followers asked, And the question was how can future UH physicians balance innovations like AI and personalized care with the ongoing need for empathy and community-focused care?
Yeah, so that's a great question. It's something that we're actually talking about a lot right now is how do you incorporate AI into care delivery? We actually have a big NIH grant about doing that. And what I'd say is one of the big changes over my career has been the implementation of the electronic medical record or the electronic health record. Mm-hmm. And it's caused a lot of unanticipated problems, okay? Now, it's made communication between specialists easier. It's made documentation easier. It's made, the ability to look up all the labs and that stuff much, much easier. But it also takes a lot of the physician's time. And so physicians have become, you go spend 10 minutes with the patient, and then you got to go spend 10 minutes putting stuff in the EMR. Yeah. And so one of the things we're really looking forward to AI doing, and it can do this to some extent now if you can pay for it, is getting rid of that documentation phase, right? So can the AI just pull from the ambient room, pull all of the interactions and put it into documentation in the medical record and save you that 10 minutes. So now you got 10 more minutes to spend with the patient. Yeah. Right? So that's the goal of this, is simplifying some of these tasks that have sprung up that aren't, traditional, physician role, having to document everything. Yeah. And doing it in a cost-effective way so you can spend more time with the patients.
I really like that answer. Amazing.
I feel like with the AI, especially, it's a tool, and I feel like it can really be useful in the medical field if just used correctly. I feel like that's one thing is it's especially now with how it's growing. I feel like a lot of busy work that happens can be done with AI now. Yeah.
Yeah, I had a discussion today about an AI scheduling program where it's a human voice that can have a conversation. It can help you get scheduled. It can deal with scheduling problems, and it eliminates us having to answer phones and put people on hold and all that stuff. Wow. And people like talking to the voice. So yeah.
All right. So the last segment that we're going to talk about is just a general advice for some of our viewers at the Dreamers podcast. I can start with the first question. Mm-hmm. The first question that I have for you is for aspiring doctors, especially from underserved background, like all of us up here in Houston, what mindset do you think is most important to carry through the long journey of medical training?
Yeah, so I think one of the big things, I think it's hard work. So it's a work ethic because it is hard work and you have to do the work. And there's, I think, a tendency in many of today's students, particularly those who are coming through after AI, is that we can take some shortcuts. Yeah. And it doesn't work too well in medicine because it's a lot harder than it is undergraduate. So I think that's one of them, is having that work ethic and being willing to put in the time and the effort. And I understand when people come from underprivileged backgrounds, there's a lot more going on. And I know about some of that from my personal journey and having to work when I was in high school and take care of my brother and sister on the weekend, because my dad was away or whatever. And that's challenging for some of our students. It really is, because they have other stuff outside of school they have to deal with. But having that work ethic, being able to control the chaos and to be, to have that ordered, set of skills to get through are very important. So I think that's the main thing to me. I think the other big piece is really just the flexibility, because medical school throws a lot of things at you, and you have to jump from one topic to another, and sometimes one way of learning to another. And so the ability to incorporate that and sort of have a flexible mind where you can roll with the punches and be in the clinic one day and then be taking a test on the circulatory system the next day. And then
so you got to be ready for the change.
Got to be ready for change and change management. And again, that comes back to how well organized are you and how prepared are you for that. And not every college student these days is as organized as they need to be to get through medical school.
Agreed. Okay. Good advice.
Yeah. And then one more was kind of how you pursued higher education first in your family. A lot of people, I would say, that are first-gen students or just first in their family that are trying to pursue higher education and kind of see it as a distant dream. What advice would you give them?
Yeah, so I'd start with the end goal. And medicine is this endlessly broad canvas, right? You can be an educator. that's teaching at a college of medicine, right? Yeah. Teaching students. You can be a researcher who is doing research anywhere from the most basic molecular stuff to very applied stuff about how do we put AI into a clinic and help help improve care, right? So there's a whole continuum of research. You can be a community worker where, we have physicians here whose main job is working with the homeless and how do we improve the homeless situation in Houston. That's a physician role. Yeah. And then within the actual clinical care realm, people seem to think about their primary care doctor and that's the role model, but there's an endless spectrum of different jobs within medicine, some of which are very patient focused and some of them which may be behind the scenes and you're not necessarily dealing with patients or that are hyper specialized in one area of the body or one surgical technique. And so it's just so much out there that you need to go in with a broad mind and say, even though we're going to push the primary care maybe through our curriculum and through the selection process, there's so much to do. I think there's something for everybody and people need to be, to want to go out there and explore it and be there. So that's what I would say, kind of starting with the end goal. Starting on the front end, again, I think it's having good study habits and learning to be organized because it's difficult once you get in here to do that.
That's great advice. And I think this is our end right now. Thank you so much, Dr. McCullers. I feel like your journey is very inspiring and it kind of shows that medicine just isn't about science, it's about serving the community, it's about purpose. And I think it's a beautiful story that you have.
Well, fantastic. Well, I think it's great that you guys are doing this and getting some of this out. I wish you a lot of luck in it. And hopefully having me on the podcast will boost your numbers for you.
Oh, thank you so much.
No, I really hope it does. And if you guys enjoyed Dr. McCullers' story, feel free to give us a like, subscribe, share our video, and help us grow into this channel because we're just like Dr. McCullers. We're trying to bring medical professionals to the podcast and share their stories with you guys. So otherwise, keep dreaming, and we'll see you at the next episode of the Dreamers Podcast.